Charity. I'm going to be your nurse, student nurse today. Can you tell me your name and your date of birth? Okay. Holland Jane, 9/20/1950. Okay, good. I'm going to be dressing your wound, do a wound dressing on you today. Do you have any pain? Any allergies? Oh, allergic to penicillin. Okay. I'm supposed to check doctor's order before doing a wound dressing on you, but for the purpose of this, I'm gonna just go ahead and do a wound dressing on you. Okay? Okay, thank you. Okay, I'm gonna go ahead and arrange my tables, okay? So I know I have my normal ceiling. I have my packing strips. I have my biohazard bag, and I also have my my dressing change tray. So sanitize. Now go ahead and put on the glove. I'm going to raise the bed to a working position so I don't hurt my back. I don't know, for some reason this bed is just okay. Good. I'm gonna try to expose the area where you have your wound. Okay. I'm gonna put my biohazard bag just where I can get everything closed. I'm gonna put this here so I don't soil you or soil my patients. Okay, so now I'm taking out the old dressing and assessing the skin and to make sure that everything is okay. I'll go ahead and take this. Make sure I hold the skin so I don't pull out my patient's skin. Okay. Okay, so my dressing is, there's no drainage, there's no color, no redness, and there's no odor. So I'm going to put it in my biohazard bag. And also I'm going to go ahead and take out my gauze. There's actually no drainage, no color, no redness, and there's no odor. So same with this. And I will go ahead and, so normally I'm supposed to take this out with a little stuff, but I'm just going to go ahead and take it out with my hands. There's no drainage, no odor, no redness, and I'm gonna put in my biohazard bag. So I'm gonna assess the skin. There's no redness on the skin, no edema, no drainage, no eschimosis. Sorry, I don't know how to really pronounce the word. And the wound is approximated. So for redness, no edema, no eschimosis, which is drainage, no drainage, and no approximation. So, and the skin, it looks like it's really healing fast. Okay, so I'm gonna go ahead and take out my glove, sanitize my hand. Now I'm gonna put on a new glove so I can clean my table, make sure my table is clean. So take this, I'm gonna set this on this table, making sure everywhere is clear. So I'm going to clean the table, clean the side. And I'm going to leave it to dry according to the manufacturer's time, which is about 2 minutes. And I'm going to sanitize my hands again. And at this time, I'm going to put on a new glove just to make sure I don't contaminate what I'm going to use for my patient's dressing. My table looks dry, it's dry, so I'm going to go ahead and bring my normal saline, my packing strip, and my dressing change tray. Now I'm going to cut open my dressing change tray. I'm going to go ahead and bring out my packaging, making sure I'm not contaminating anything. Keep it here, and I'm going to try to take this out on this very slowly, and I'll go ahead and open my packing strip, my normal saline. And while I take out this, I'm going to set this on a comfortable position so my hands get to everything and it's not occupying so much space on the table. So all this are sterile, so I'm going to try to hold on a 1-inch margin, and I'm going to hold it in a way that I'm not contaminating anything, and I'll pour it out. So I will put this just close by, and I'm going to take off my glove. Sorry. So I'm taking out my glove. Okay. Now I have everything set out there. Now I'm going to sanitize my hands again before and I know to pour my normal saline, holding on the label. I'm going to take out a little of this on the trash, and I'll put as much as possible so I can clean my patient's dressing. And now I'm going to put on my sterile gloving. So I'll try to make sure I don't contaminate my glove. So I'll use the 1-inch margin. For some reason it's all, so because it's turned this way, I'm going to try to put it in a way that is close to me, making sure I'm not touching my 1 inch, and I'm going to open here. So this is my dominant hand, so I'm going to pinch 1 finger, making sure I'm not contaminating my glove, although it feels tight, but yeah. And I can adjust it when I'm done with this hand. And I'm going to put this just making sure my hands are not touching this. Now I can now pull this and fix my hand tight. So with this, I can take out my gauze, and I knew how much I took out from here, so I'm going to go ahead and put my gauze in. I took about 3 because the wound is there's no drainage on the wound, so I'm using as much gauze that'll be okay for it. And I have my scissors. So I'm going to go ahead and pick as much as I took from there, because sometimes these things can be so hard to hold. Jesus. For some reason this is contaminating, so I'm going to cut this out and make sure I don't use this part and throw, and I'm going to take a new one. Yeah, now I have a fixed grip on it. Okay, so this can be here. So I'm going to go ahead and clean up my patient's wound. Take out some of this. I'll go in a circular motion. I have 1, and I'm gonna go 2, and that's that. Now I'm gonna go ahead and pick, since I have my sterile gloving, I know I'm not contaminating this, so I'm gonna pick my packing strip, and I'm gonna fold it with 1.5 inch, so I can make sure to leave a little at the edge, and I'm going to throw this away. Now, because that is clean and everything is going on well, I'm going to put on my gauze. So I'm putting the first gauze, and I have the second. So now I'm gonna put on my wound band. Make sure it's straight, and I have my tape, so I'm going to use my tape and so I know to not use so much tape, because sometimes this tape can be irritating to the skin of the patient. We're trying to protect his skin, so I'm going to use on tray side, just, and I have to use on this side. So I have just one more side to use, the last. Okay, and now I have that done. I'm going to take off my glove. Make sure to clear up my tables. Cover up all that needs to be covered. I'm going to sanitize my hands. So I know to write my name, my initials, the time, and the date. 10, 14. Okay, thank you. And I'm gonna put the head of my patient down. I'm giving my call light, his call light. Can you call me when you need anything, okay? Thank you.